I'd like to welcome Lisa Walker. Hello. Hello, Lisa. Lisa, you just need to hold that. No, you won't hear it. Fab. So I'm Lisa. I'm one of the nurses, one of the HIV specialist nurses for the Marram Clinic. You'd be forgiven if you've never heard of the Marram Clinic. We've only existed for about a week and a half since Sexual Health Services actually sadly left the trust. We've been through a pretty difficult time, but we're trying to turn this into a really positive thing, and we're rebranding. So we're calling ourselves the Marram Clinic. We're now a small team of 3 consultants, 1 pharmacist, 2 nurses and 2 admin staff. So what do? We provide holistic care for the people of Cornwall living with HIV. So if you don't know, human immunodeficiency virus weakens your immune system, and it stops your ability to fight everyday infections and disease. It's treated with antiretroviral medications, and they work by stopping the virus replicating in the body. This allows the immune system to repair itself and prevent further damage. So we support people through their journey from newly diagnosed, lots and lots of support with those people, partner notification and contact tracing to stop onward spread and identify people at risk in the community. We see people as often, we tailor our care to them. We see them roughly every 3 to 6 months, ideally 6 months, but every time they come and see us in clinic, we do lots of bloods, lots of looking at their medications, are they taking them well, healthy lifestyle support. We signpost to other services like addiction, counselling, lots of psychological support with our patients, and we also look after any inpatients that are in RCHT. Okay. So we've had loads of ideas, lots and lots of ideas of what we could do to improve and enhance brilliant care in our service. What we've actually concentrated on is looking at our waiting area to improve this for our patients. So we would really, really love a wall mural, something really nice for our patients to look at, to immerse themselves in and lose themselves while they're waiting for their appointments. A fish tank, because again, this is really good distraction therapy for our patients. A radio, something really simple that we don't have. A television, so that we can play health promotion information on it as well as watching telly if they want to. And some magazine subscriptions that are actually relevant to our patient group. So, why is this important to us? Roughly every 2 years, we survey our patients and we ask them what they think about our care, what we're doing well, what isn't so great. Overwhelmingly, the feedback is excellent. They love our service, they think we do a really good job and they're happy. But the waiting area is always something that they comment on as somewhere that could be improved. Coming to clinic is the one time that patients can often be themselves. It's their safe place. They can talk openly and honestly. And we want to do our absolute best to support them through this and make their clinic experiences as positive and as meaningful as they can be. Lots of our patients feel very alone and isolated with their diagnosis of HIV. They're too afraid often to talk to their loved ones for fear of their rejection, fear of their reaction. HIV and medicine has come a very, very long way since the scary tombstone ads of the 80s. The stigma, fear, and lack of understanding sadly hasn't mirrored that. It's still there. Clinic visits can evoke a whole range of emotions for our patients. It can take them right back to the day that they were diagnosed. It can take them back to bad experiences that they've had with other clinicians in other places. And some people just don't like having bloods done or just waiting to see a doctor. It can be quite scary. A few of our patients like coming to clinic as the walk of shame. Quite a lot of our patients have got a very negative self-perception. They don't feel like they deserve anything. They feel like it's their fault they caught this disease and that they just don't have any ownership over anything. We would really like to improve their outcomes. We want the area to be really friendly, inviting, calming. We want to empower our patients and help them reduce their anxiety and stress. Most of all, we want them to feel like they're valued and that we've actually listened to them and that we've done something about what they've said for once. We know we've got a really good service, and I just wanted to share with you some of the lovely comments and some of the heartwarming comments that people have actually said about our service in this last survey. Thanks for listening.
Thank you. So Lisa, you said it was really nerve-wracking, but I need to let you know that we wouldn't have known that you were scared because you did a fantastic job. So thank you very much. We really absolutely felt what you did. So thank you. So who wants to go in with a question for Lisa?
Oh, I can start. Where's it going to be? Is it where the current waiting room is in the hub?
Yes, it's downstairs in what was formerly called the basement at the hub. We didn't like that name, we thought it was quite seedy, which is why we thought a new name was definitely needed. So yeah, downstairs in the hub.
Okay. And in terms of, I completely get the principle. I think it's an excellent principle. But in terms of what you'll spend the money on, so things like magazines and having the radio on, isn't that a bit old-fashioned? I just think about my GP appointments when I go and wait, and there's dog-eared magazines in the corner, and they're playing Radio Cornwall, and it feels a bit tired. So how are we going to keep it fresh?
So we've come to ask patients what they want. We have got a very old radio that will only play slightly a crackly noise in the background, which is just hideous, and the patients hate it. Yeah. But there's only ever a couple of patients in that waiting room at one time, so they're actually able to change it to what they want. It can be very individual. Magazine-wise, I've asked a lot of our patients what they would like to see. They'd like to see some LGBTQ magazines in there. There's nothing, it's Chat and Bella and really rubbish magazines that they just don't relate to. So we've been trying to ask as much as possible what they would like, and that's what we've reflected in our bid today.
Okay. Thank you.
Okay. Adam, anything from you?
You've obviously put a lot of thought into it. It sounds quite simple in terms of buying some furniture and a fish tank. You put a lot of thought into it as to why. So I really like that. So thank you very much. Who's going to clean the fish tank?
The team. It's really lovely. We've got lots of patients that are actually really, really into fish. They do aquascaping. So we've got a little team of people that have volunteered to help us maintain it. It will be the team, me. I'm happy to do it, and my colleague who works 4 to 5 days a week, she's going to do it as well. So between us all, we're going to make sure that they're cared for. We don't want any fish to die.
Okay.
Don't want that on our conscience.
But just if you are successful, rather than buy a magazine subscription, you can get an iPad. There's an app called Readly, which has got lots and lots of different magazines. So as many magazines as you want for £10 a month.
And I suppose the question that was striking me was, I think, thinking about some of the amazing work that's been done on some of the corridors over the way there in terms of art exhibitions and that sort of thing, and whether there's an opportunity for you to explore that as an option, as a way of getting something great on the wall, but perhaps not paying for it. I don't know if you've looked into that at all at this stage.
We haven't at this stage, no. It was the...
What have you been doing for the last week and a half? Yes.
It's been a terrible couple of weeks. It was in the tower block, the lovely Cornish pictures that they put up. That I saw that one day when I was walking the Bloods over, and that just kind of inspired me. I thought, actually, gosh, we could do something like that in our building.
Yeah, absolutely. Okay, I think we're done. Lisa, thank you very much indeed. Thank you. Well done.
So how did you feel after that?
I was relieved it was over. It was quite a terrifying experience.
Walking in by yourself?
Yeah, absolutely. It's something I've not really done a lot of, so it was quite a new thing for me. But it was good. Yeah,
you really enjoyed it?
Yeah, I did actually.
Would you encourage other people to give this a try?
Yeah, I think if you feel passionately about something, and it's one of the only ways you can get nice things for your patients, then do it, definitely. It's 5 minutes, it's 5 minutes of your life, and if it means it can make a difference to your patients, it's a winner, definitely.
Thank you.